The mechanism of delayed type hypersensitivity reaction. Type 4 hypersensitivity is also known as delayed type because the duration between contact of antigen and appearance of symptoms, it is 2 to 3 days, like 24 hours to 72 hours is the duration. So it is known as delayed type hypersensitivity. It has two phases. First is sensitization phase and then effector phase. In the sensitization phase, we have antigen presenting cells. So antigen presenting cells will process and present the antigen along with MHC2. So they will present the antigen to helper T cells, and these helper T cells will be differentiated into T DTH cells. DTH stands for delayed type hypersensitivity. So these T DTH cells are generally TH1 cells, but occasionally they can be TH17 or TH2, or they can even be CD8 plus T cells, cytotoxic T cells. So sensitization phase में the antigen presenting cells will process and present the antigen along with MHC2 to the T helper cells. The T helper cells will be differentiated into T DTH cells. These delayed type hypersensitivity T cells are generally TH1 cells. Occasionally they can be TH17, TH2 or CD8 plus T cells. Then second phase is effector phase. In this phase, the differentiated TDTH cells, when they will come in contact with antigen, they will secrete certain cytokines. The TDTH will secrete cytokines like interferon gamma, interleukin 2, tissue necrosis factor beta, MCAF, that is monocyte chemotactin and activating factor, MIF, that is migration inhibitory factor, interleukin 3, and GM-CSF, that is granulocyte colony stimulating factor. So the TDTH cells will secrete certain cytokines, जिसमें interferon gamma will be the chief cytokine. The other cytokines are interleukin 2, tissue necrosis factor beta, MCAF, that is monocyte chemotactin and activating factor, MIF, that is migration inhibitory factor, interleukin 3, and granulocyte monocyte colony stimulating factor. So these cytokines will attract inflammatory cells like macrophages. The interferon gamma will convert the resting macrophage into activated macrophage. These activated macrophages, they will increase the class 2 MHC molecules, they will increase tissue necrosis factor receptors, and they will also increase oxygen radicals and nitric oxide. So the activated macrophages will increase class 2 MHC molecules, they will increase tissue necrosis factor receptors and oxygen radicals and nitric oxide. So this is the mechanism of delayed type hypersensitivity reactions. There are two phases, sensitization phase and effector phase. In the sensitization phase, the antigen presenting cell will process and present the antigens along with MHC2 to the helper T cells, which will differentiate into T DTH cells. In the effector phase, these differentiated T DTH cells, when they will come in contact with antigen, they will secrete cytokines, जिसमें main cytokine is interferon gamma. These interferon gamma will convert the resting macrophage into activated macrophage. The activated macrophage will increase class 2 MHC molecules, they will increase TNF receptors, and they will also increase free radicals, oxygen radicals and nitric oxide.